Coronavirus. Does the COVID-19 affect dogs and other pets? Hello and welcome back to Pets Aplenty. If you are new to this channel, don't forget to hit the like and subscribe button for more amazing videos.
Now, a tiger at a zoo in New York has tested positive for coronavirus.
What you need to know about COVID-19 and pets and other animals. The coronavirus has a large family of viruses that range from the common cold to Middle East respiratory syndrome. About 20% of colds are the result of a human coronavirus. Animal species have their own coronaviruses that cause a variety of illnesses. The dog, cat, pig, and cattle coronaviruses are very common and do not cause illness in people. SARS-CoV-2, the virus responsible for COVID-19, originated from wild animals, likely from bats. Due to mutations that created a new virus, it developed the ability to infect humans and spread efficiently from person to person. A few dogs and cats living with COVID-19 patients have tested positive for the presence of the virus.
It is the first known case of a dog with coronavirus.
But local and federal officials say showing that effect might not be a good idea right now. Instead, you should treat them like humans with social distancing and, of course, proper hygiene.
Research is ongoing in multiple species to study how animals may be affected. It is not surprising that SARS-CoV-2 can infect some animals under certain conditions. Other human viruses like H1N1 influenza and SARS-CoV-1, which is very similar to SARS-CoV-2, have also spread from people to animals in low numbers, most notably in cats, ferrets, and pigs. There is no evidence to suggest that a naturally infected animal is capable of transmitting infection back to humans. Researchers at the University of Wisconsin inoculated 3 cats with a novel coronavirus and put them in separate cages. A second cat that had not been inoculated with the virus was added to each of the 3 cages. Each cat that became infected and passed the virus to their cage mate, though a few of the previously reported cases of SARS-CoV-2 in cats have displayed signs of respiratory disease. None of the 6 cats in this study developed signs of illnesses and all were virus-free within a few days. A previous study found similar results, though only one of the 3 pairs of cats transmitted the virus. This research demonstrates that transmission between cats is possible with prolonged close contact. It does not tell how likely this is to occur in natural settings. The researchers urged people not to forego the comforts of feline companionship. Humans are the clear dangers in terms of disease transmission, not pets. Confirmation of novel coronavirus in cats continues to be a very rare occurrence. The recommendations from the CDC to protect people also apply to pets and remain unchanged following this study. People sick with COVID-19 should isolate themselves from other people and pets, including those in their own household. Keep distance between yourself and others outside of your home, at least 6 feet. Keep your pets indoors when possible to prevent contact with other people and animals outside. Wash your hands often. What is the risk of infection in pets? SARS-CoV-2 has been confirmed in cats, dogs, and ferrets. Overall, dogs appear to be more resistant than cats, and ferrets have only been diagnosed in a laboratory setting. Confirmed cases in pets are exceedingly rare, with mild or no clinical signs of illness. It will not be surprising to see additional cases identified in pets during the days and weeks to come, especially as more research is being done in this area. The risk of your pet developing illness from SARS-CoV-2 remains incredibly low. This risk can be reduced even further by treating your pets like any other member of your family. Keep them home and away from people and animals that don't share your household, and avoid close contact with those who are ill. What else do we need to know about SARS-CoV-2 in animals? There have been several reports of animals testing positive and other research studies related to SARS-CoV-2 and animals. The American Veterinary Medical Association has created an in-depth summary of the cases here. A recap of the current developments include local, state, and federal partners, including CDC and USDA, continue to collaborate using a One Health approach to investigate SARS-CoV-2, the virus that causes COVID-19, in people and animals. You can find updated information and sources on COVID-19 in pets and other animals on CDC's Pets and Other Animals page. While dogs can be infected with SARS-CoV-2, there is no evidence that infection causes disease and no evidence that they transmit the virus to humans and other animals. We continue SARS-CoV-2 surveillance efforts in companion animals in order to establish a more complete understanding of how underlying health conditions such as cancer, diabetes, or heart disease might influence outcome of infection. A German Shepherd in New York that displayed signs of respiratory illness tested positive for SARS-CoV-2 infection, and another dog in the household showed no symptoms but tested positive for antibodies to the virus, suggesting exposure, according to the USDA's Animal and Plant Health Inspection Service. One of the dog's owners tested positive for COVID-19, and another showed symptoms consistent with the virus prior to the dog showing signs. A cat in Minnesota whose owner tested positive for COVID-19 was found to be infected with SARS-CoV-2, but a dog in the household shows no signs of illness, according to the Minnesota Board of Animal Health. The cat was tested at a veterinary clinic after it was presented with a fever and clinical signs of an upper respiratory illness. A dog from a household with several confirmed COVID-19 cases tested positive for the virus in North Carolina. The dog was reported to have mild signs of illness and recovered quickly. A cat and another dog in the same household were negative. Two cats living in homes from different areas of New York tested positive for the virus responsible for COVID-19. Both cats displayed signs of a mild respiratory illness and made a full recovery. Another cat in one of the households had no clinical signs and tested negative. Though these were not the first positive cats, they were the first in the US. Two research papers were released from the US demonstrating that cats and ferrets are able to transmit infection to animals that are housed in their cages. Not all pairs, but one infected and one uninfected in a cage resulted in a transmission to the uninfected member. A few research papers have been released from China and South Korea. In these studies, very large doses of SARS-CoV-2 were experimentally given to animals. The results suggest that cats and ferrets are susceptible to infection, dogs are less susceptible, and pigs, chickens, and ducks appear to be resistant. It is important to keep in mind that this research does not mimic natural infections, and there were only a few of each species tested. Additional studies will add to our understanding of this virus. What preparations should I make for my pet during the pandemic? As you quarantine or shelter in place, ensure that your plans include your pets. Make sure you have everything your pets will need to stay at home with you. These suggestions will help you prepare. Be sure to have at least a 2-week supply of food, maintenance medications taken daily, and necessary supplies like litter, supplements, dust baths, etc. Veterinarians will often fill up to a 90-day supply for many medications. Talk with them about the best option for your pet. You could also request a prescription to use at a human pharmacy in case the veterinary clinic is closed or otherwise unable to provide a refill when it is needed. Refill monthly medications for fleas, internal parasites, heartworm preventive maintenance, etc. if you are down to a 2-week supply. Keep a current copy of your pet's medical records, including vaccine history, health issues, and current medications in case you need to seek urgent medical care from a veterinarian other than your own. In case you become sick or injured and unable to care for your pet, identify a friend or family member who is willing to take care of your pet. This is important if you live alone. Provide this person with written authorization to enter your home and access to a key. What should I do if my pet is exposed to COVID-19? If your pets have been exposed with COVID-19 and develops a respiratory illness, please discuss this with the veterinarian. They will likely recommend testing for more common causes of these signs in pets before considering the unlikely possibility of COVID-19. According to the CDC and the National Association of State Public Health Veterinarians, testing of healthy animals that have been exposed is not recommended. Can pets carry the virus responsible for COVID-19 on their fur? The length of time the virus can survive on a surface varies based on factors including temperature, humidity, and the type of surface. Though survival on fur hasn't been studied for this virus, knowledge of similar viruses suggests that it is not expected to survive for long. Our current understanding is that pets do not play a role in transmission to people. Will the coronavirus vaccines protect my pet from COVID-19? There are other coronavirus variants that infect animals, and there are vaccines available for some of them. Although these viruses are in the coronavirus family, each one is a very different virus. Vaccinating animals or people with existing coronavirus vaccines is not expected to provide cross protection, and they should not be used for this purpose. If you have any questions or concerns regarding your pet, you should contact your veterinarian since they are most familiar with your pet's health and can best guide you. If your vet is not available, reach out to the nearest emergency veterinary clinic for advice. During this pandemic, we should be more extra careful with our pets. Always wash your hands and wear a mask to protect yourself, your family, and your pets. If you like this video, don't forget to hit the like button and subscribe and turn on the notification bell so you'll be the first to know when we upload a new video. Thank you for watching, and we will see you on the next one.